Welcome to Prepare Tennessee LTC, a podcast created to provide resources and information on the current topics experienced within Tennessee long-term care and skilled nursing communities. I'm your host, Rachel Turner, an Associate Program Manager here at Vanderbilt University Medical Center's Program in Disaster Research and Training. Today, I am here with Dr. Michael Freeman and Dr. John Walsh, two co-directors of Vanderbilt University Medical Center's Program in Disaster Research and Training. Please join me in listening to their presentation on the CMS Final Rule. You are currently listening to Part 3 in a 4-part series.
Module M101C contains the CMS Final Rule requirement standards for long-term care and skilled nursing facilities. This section involves E0021 to E0034. E0029 covers the development and maintenance of a communication plan. E0030 is the communication plan maintenance of names and contact information. E0031 contains the communication plan maintenance of list of officials and agencies. E0032, the primary and alternative means for communicating during emergencies. Section E0033 contains established options and alternative means of communicating for facilities. Lastly, E0034 of this section is the communicating occupancy status, needs, and ability to assist. Section E0029 is the development and maintenance of a communication plan. The communication plan is a collaborative and interactive document that defines how resident care is coordinated within the facility, staff and corporate offices, community partners, other healthcare providers, and with other state and local public health departments. The communication plan must state how the facility will coordinate care in order to protect the health and safety of its residents during an emergency. This includes establishing protocols and procedures, how it will maintain situation awareness, interact and coordinate with emergency management agencies, other healthcare facilities, and other local and regional systems of response. How this communication system of coordination of care is accomplished is up to the individual facility and its available resources.
Other communication considerations include facilities that only have basic communication connectivity must develop alternative communication strategies to communicate with local or state emergency officials. Some may elect to use radios, satellite phones, ham radios. Emergencies of almost any scope generally develop communication issues over time. Your communications plan must address contingencies and circumstances where routine communication modes are inoperable or non-existent.
Survey procedures for E0029 verify that the facility has a written communication plan by asking to see the plan. Ask to see evidence that the plan has been reviewed and updated as necessary on an annual basis.
E0030 Communication Plan Maintenance of Names and Contact Information. The facility's communication plan must maintain and update a list of names and contact information for the following persons or entities: staff, entities providing services under arrangement, resident physicians, other facilities, volunteers. Although the standard only addresses the requirements for maintaining contact information of these 5 categories, it is prudent to expand this list to include other response and resource providers. During an emergency or disaster event, the need for assistance and resources can increase substantially. Establishing collaborative partnerships on several levels increases the survivability of residents, staff, and facilities.
Maintain working relationships with other long-term care and skilled nursing facilities, local and regional hospital and healthcare systems, various emergency management, fire, and police agencies, and supplier networks. These collaborative relationships provide a sound strategic and tactical plan for maintaining services safety and security for your residents during emergencies. Although the standard requires that this information be updated annually, it is recommended that it be updated and tested on a more frequent basis. This information must be readily available and accessible during an emergency. It is left up to the discretion of each facility how the information is maintained and formatted. However, if it uses an electronic database as its mode of information storage and retrieval, it should be able to demonstrate that it maintains a backup system with hard copies. It must also be able to demonstrate that it has the capacity to reproduce and assess contact lists during an emergency. This includes staff changes should be updated as they occur or at least on a very frequent basis. It also is important that senior management and leadership have immediate access to this information at the first signs of an emergent event occurring. Survey procedures for 𝐒𝐲𝐧𝐨𝐬𝐬. Verify that all required contacts are included in the communication plan by asking to see a list of the contacts with their contact information. Also verify that all contact information has been reviewed and updated at least annually by asking to see evidence of the annual review.
𝐒0031 Communication Plan Maintenance of Lists for Officials and Agencies. The facility communication plan must also maintain contact lists for the following individuals: federal, state, tribal, regional, and local emergency preparedness staff, the State Licensing and Certification Agency, the Office of the State Long-Term Care Ombudsman, other sources of assistance. Emergencies often require assistance and coordination of multiple agencies and jurisdictions. Establishing and maintaining good relationships and partnerships within the response community is a continuous process requiring commitment, time, and energy. Identifying all the various agencies and organizations that are potential sources of assistance to your facility during an emergency is a larger task than you may initially anticipate. Collaborating with the following agencies and organizations will assist in this process: County Emergency Management Agency, Regional Healthcare Coalition, Regional Hospital Coordinator, Community Response Agencies, non-governmental organizations, otherwise known as NGOs. LTC and SN facilities are given the flexibility for developing and maintaining their contact lists. Whether electronic or hard copy format, contact lists should be available and accessible at all times.
Survey procedures for 𝐒0031. Verify that all required contacts are included in the communication plan by asking to see a list of contacts with their contact information. Verify that all contact information has been reviewed and updated at least annually by asking to see evidence of the annual review. Section 𝐒0032 covers the primary and alternative means for communication during emergencies. The facility communication plan must also provide for both a primary and alternative means for communicating during emergencies and disasters. For smaller facilities in rural areas with limited resources, the options may be to establish basic lines of communication between your county emergency management agency and/or your local fire and police departments and sheriff's offices. Landline or cellular phone may be the primary source of communications, and in case of emergencies where phone service is disrupted, it may take someone simply getting into their vehicle and driving to the fire or police station.
In facilities that have access to more resources or are located closer to more urban areas, communication sources may be more plentiful and easier to access. Ham radio operators can be found almost anywhere amateur radio enthusiasts exist. In some cases, local responders, fire, police, and emergency management may allow LTC and SN facilities access to their radio frequencies during emergencies. Protocols must be established defining when and who has authorization to use these communication modes, and facilities should provide training for their staff on the equipment. Collaborating with local responder agencies can make this an easy process, can guarantee that your facility has use of alternative communication modes that are also used in coordination with your local and regional response system.
The federal government offers a number of communication assistance programs which your facility may qualify for acceptance. You will find them under the National Communication System, NCS, designated as the National Security and Emergency Preparedness Communications Services. Examples include Wireless Priority Service, WPS, Government Emergency Telecommunication Services, GETS, Telecommunications Service Priority, TSP program.
Survey procedures for 𝐒𝐲𝐧𝐨𝐬𝐬𝐢. Verify that the communication plan includes primary and alternate means for communication with facility staff, federal, state, tribal, regional, and local emergency management agencies by reviewing the communication plan. Also, ask to see the communications equipment or communication systems listed in the plan. 𝐒𝐲𝐧𝐶 establish options and alternative means of communicating for facilities. The communications plan, as so far outlined, consists of several elements all designed to enable continuity of services and establish options and alternative means of communicating for facilities during emergencies and disasters. Standard 𝐒0033 addresses requirements associated with resident information sharing and medical documentation, as well as transfer and release of resident records during emergencies. This includes situations where the resident has been evacuated or has been sheltered in place. The information should be easily retrieved and readily available. The documentation requirement is for all residents under the facility's care or under the care of other healthcare providers when a resident has been transferred in order to maintain continuity of care. When a resident is transferred or evacuated, resident care information should remain with the resident during this process, allowing for effective treatment and continuity of care.
During emergencies, time constraints may not allow for all resident medical records to be transferred. However, at a minimum, resident information should be available and accompanied with the resident. Some examples include name, age, date of birth, blood type, medications, medical diagnoses, reason for admission, advance directives, emergency contact information of next of kin, and others. If possible, medication needed in the near term should also be sent along securely with residents. In times where evacuations are conducted, facilities must have established means for releasing resident information under 45 CFR 164.510 and a means of communicating information regarding residents' general condition and location under the facility's care as allowed under 45 CFR 164.510B4. Facilities under this standard must be capable of disseminating timely and accurate information concerning residents to family members and others as directed also under 45 CFR 164.510B4. Under the HIPAA privacy rule, certain allowable uses and disclosures of protected health information are authorized during emergencies and in disaster relief efforts. Permitted disclosure of resident information is given when authorized by law or charter for assisting in relief efforts. This allows facilities to provide information regarding the resident's location and general condition in order to notify family members, personal representatives, or other specific individuals.
Survey procedures for 𝐒0033. Verify the communication plan includes a method for sharing information and medical documentation for patients under the facility's care and is necessary with other health providers to maintain the continuity of care by reviewing the communication plan. Verify the facility has developed policies and procedures that address the means the facility will use to release patient information to include the general condition and location of patients by reviewing the communication plan. 𝐒𝐲𝐧𝐨𝐩𝐬𝐢, communicating occupancy status, needs, and the ability to assist. Within the facility's emergency preparedness communications plan, the facility must establish the means for communicating information regarding its occupancy status, needs, and its ability to provide assistance during the emergency. This information must be communicated to the jurisdiction with command authority over the incident and the Incident Command Center or its designee. Under the structure of the response system, the command could include the local, county, or state emergency management agency, the designated emergency operations center, or the local and state public health agency. In order to accurately provide this information, the facility must have a good assessment of its capabilities and capacities. In large or broad scope incidents, other facilities may rely heavily on your ability to assist and offer much needed resources. Within the standard, the definition of occupancy needs and assistance are not specified. For emergency purposes, occupancy would include bed availability, the number of residents receiving care and treatment at the facility, and the facility's certified occupancy rating. Those numbers will help determine the facility's ability to accept residents from other healthcare facilities or the need to discharge or transfer its own residents. Needs may vary from determining available subsistence and medical supplies, equipment resources, or manpower and staff availability for resident evacuations or transportation transfers.
The facility administrator or emergency preparedness coordinator should maintain this information on a regular basis as part of their emergency preparedness responsibilities. Having this information readily available during an emergency will save time and assistance in decision making at critical points in the response process. Integrating and coordinating within the healthcare coalition system in your region, as well as participating in the local emergency planning committee as part of your local emergency management planning system, will provide a wealth of assistance and resources for assessing your facility's capabilities and capacities for both emergencies and non-emergency periods of operation. Survey procedures for 𝐒𝐲𝐴. Verify the communication plan includes a means of providing information about the facility's needs and its ability to provide assistance to the authority having jurisdiction, the Incident Command Center, or designee by reviewing the communication plan. For LTC facilities, verify if the communication plan includes a means of providing information about their occupancy.
If you have questions regarding anything that was mentioned in today's podcast or would like to learn more, please visit our website at www.emergencyltc.org.